Okay, guys, we are going to start, I guess. So tell everyone to join us. Let's start the lecture because we had some technical problems. So now it's good. I guess everyone is listening to me, and we can already start the lecture. So today we are going to talk about MS. MS is multiple sclerosis. So it's demyelinating neurological disease. So if you are going to talk about multiple sclerosis, so it means that here multiple sclerosis. Okay, so instead of me not repeating every time multiple sclerosis, we are going to say MS, right? If I say MS, everyone should understand that I'm talking about multiple sclerosis. So it's a demyelinating a disease, right? So then demyelinating is what? We are talking here about myelin. Myelin is a shell of the neuron, right? Neuron's shell. So it's covering the neuron, it's covering the neuron. So this shell which is covering the neuron, it's called myelin. So let's see the function. So myelin functions are a nutrition of the axon. So when you get a neuron, long neuron, inside of it there is an axon, and now the myelin now is covering the axon. So this one that it has the function of nutrition. Also, it has it's covering it. So it means that it's taking care of the axon, and also it has the function of accelerating the nervous impulse. So it's why if you remember when we talk about vegetative nervous system, right? When we said that the preganglion has got this one myelin shell, we talk about a high speed, right? It has got from 70 to 120 meter per second. So here why? Because it has got this one myelin shell, right? So myelin shell has got the function of accelerating the nervous impulse, right? So reference function, and it has got a barrier function, right? Here we are talking it's protecting, right? Barrier. It doesn't let other thing to touch the neuron, to touch the axon. So all those functions. So please remember the 4 functions. So now, if we are going to talk about a classification of the myelin diseases, so here we need to understand that first of all, when myelin is going to be destroyed, right? We are going to have a myelinopathy, right? We are going to have a myelin cluster or demyelinating disease. You have here neuro X, multiple sclerosis, either myelinopathy, you have got leukodystrophy or adrenoleukodystrophy. So the basis of myelinopathy is genetically caused by biochemistry defect in the myelin structure. But myelin cluster or demyelinating diseases is causes by this one myelin this one defection, which is caused by exogenous factors or endogenous factors, right? So within all those diseases, between all those diseases, we are going to talk about MS, multiple sclerosis. Why? Because MS is a huge is a disease that touches a lot of people, right? In Russia here it touches a lot of people. So we are going to talk about multiple sclerosis, MS. So etiology, whatever where you hear the word etiology, it means causes. Etiology is just a scientific, medical, like terms that like we always like use to say like etiology. But you need to understand that when a doctor or when a teacher is talking to you about etiology, so obviously he's talking to you about causes. So the causes of multiple sclerosis, we have got like endogenous factors. When we are talking about endogenous factors, it means like inside of our body, right? Endogenous, endo in Latin, like it means like enter, right? Enter. So it means like inside. Whatever way you listen about endo, so it means like inside. So the inside like factors are like this one, the genetic insufficiency of immunoregulation. So here like it caused by our like insufficiency of immunoregulation. So this one is the endogenous factors. Now when we are talking about exo is out, also like Latin from ex, so it means like exo factors. So when or whatever where you hear like exo factors, it means like outside. So here like mostly look at where like you can meet like mostly MS. MS you can meet them like in this one like let's say Baltic, right, or Scandinavian like countries, North America, and less often you can meet them like Middle East, Central Asia, or Equatorial Africa, and also like it has got like a food future like viral and bacterial infections. Viral and bacterial infections can cause also like MS, right? So, pathogenesis. Whatever, where like you hear about pathogenesis, it means like the action, how like the disease like occurs, right? Is the action, is the development of the disease, right? So when now what happened? What's happening exactly? So the pathogenesis of multiple sclerosis, in the blood vessel we have like T cells which are going to be activated. And now when T cells will be activated, there will be like a production of cytokines. Cytokines are inflammatory like this one as subject, right? So here like this one, the cytokines now like holds and form in the blood-brain like a barrier. So it's going to form like a this blood barrier. So from here, when it forms, we are going to have like a T helpers. T helpers penetrate the blood, right, the brain barrier. So our brain has got what? Has got like a barrier. But the T helpers can penetrate like a barrier, right? So from here, there will be like a damage of myelin shells, right? So by this action, there will be like a inflammation increasing right inside the central nervous system. Okay, so when the T helpers penetrate, also we are going to have like a B lymphocytes also became like activated and produce like also autoantibodies to myelin structure. So here, what is going to happen? There will be like a demyelination in like there will be like a plaques which are going to form into our brain. So those plaques are the demyelinated like this one like myelin. So this one we should understand it. So there will be like activating of T helpers which is going like to enter like this one brain barrier, and from here there will be like an increasing of inflammatory this one's system into our nervous system. Also, like there'll be activation of the B lymphocytes, which are going to develop like plaques. Now, so after us knowing like the pathogenesis, how it's happening, so we are going to have like clinics. So clinics, like it's what we can see, symptoms, what we can see when like we are performing like this one neurological like examination, physical neurological examination, right? When we tell a patient just do this one, do that, and as we are observing, right, we observe what is happening to the patient. So here, like there'll be like a polymorphism of neurological symptoms. There'll be like when we talk with you about central and peripheral, like this one, pyramidal disorders, central and peripheral, like pyramidal disorders, we said that like they are like characterized, what clinic is characterizing like central, and which ones are characterizing like peripheral pyramidal disorders. We say for pyramidal disorders, you are going to have like a paralysis, right? You are going to have like a hyperreflexia, right? You are going to have like the pathological like reflexes, right? And you are going to have like a hypermuscular tonus. So this one is central. For peripheral one, you are going also to have like a paralysis, but you are going to have like a hyporeflexia, and you are going to have like a hypermuscular tonus, or you are going to have atrophy, right? So this one is what we said with you. Now, for MS, you can see like there'll be like almost like some symptoms from central pyramidal disorders and some symptoms from peripheral like pyramidal disorder. So they'll be mixed. Some of them like will be mixed. So it's why like here we are going to talk about polymorphism. So the things are mixed here, right? So here first you can see like a pyramidal syndrome. When we are talking about pyramidal syndrome, please, it's about like the symptoms that we are from talking with you about like a pyramidal, like central pyramidal of nervous system. Defect of the cranial nerves will be like problems with cranial nerves. You are going to have like problems with sensitivity, cerebral vascular diseases, changes in the emotional and mental sphere, right? Violation of the function, right, of pelvis organs. So you'll see either the person can't, like this one, control the urine, right? The urine is just coming out. Either the person like can't go to the toilet, can't go to toilet, can't go to the toilet. So it means that like the person can't urinate, right? Syndrome of clinical dissociation. So clinical dissociation is what I talked to you about it, when you are going to have like a mix of pyramidal or central and pyramidal, like I mean like a mix of central and peripheral pyramidal syndrome. They'll be mixed. You won't see just like a central or peripheral. So they'll be like a mix, right? Okay. You have got like symptoms of hot bath. So when the patient like goes to take like a hot bath, after taking the bath, the symptom will be increased, right? Everything like will be increased. Okay. You have got also like a symptom of the colon. You have got also like a variability of neurological status within like 24 hours. So all those ones like are the clinical of MS. Okay. So, when we are going to talk about the clinical, now let's target it, right? You are going to have like the triad of Jericho, right? So here, if you get this one, you need to start thinking about MS, right? You are got like a nystagmus. So when we are talking about nystagmus, you ask the patient, right, to take the eyes that side, and when the person take the eye that side, and you are going to see like some like fast movements, right, tick, 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 like this. So this one is called like a nystagmus or intensive tremor. Intensive tremor, right? The person like is just like checking like this, or scandalized like speed. When the person like can't speak like slowly as we do right now with you, but the person goes right, scandalized like as if like shouting on someone, right? So this one are called like a triad of Charcot. So please remember those three like a triad. Also, you have got like a penthouse like a Marburg, which are like plus the triad of Charcot. You have got like a palliation of optic disc, vision problems, and also like abdominal, like a decrease like abdominal, like this one reflexes, right? When we do like this, you can see like this one increasement, the decreasement of abdominal reflexes. So you have got like a Charcot-Marie like a triad that you need to remember, and also penthouse like Marburger, which has got like a plus triad of Charcot, optic nervous like a problem, plus like this one decreasing of abdominal reflexes. Please like remember those clinics. So, flow types of MS. How does it start? So, remitting MS. So when it starts, right, it goes, when it goes like this, it goes when the symptom occurs, and after that like it comes back normal, there will be no problem. And again when the symptoms occurs, again like it goes up, and after that like it comes back to normal. So they are like symptoms, and after like a treatment, the person like the symptoms will disappear, right? So this one is like this. So now, what is going to happen? Primary progressive MS, right? So now it is starting, right? So after that it comes down, the symptoms like it start, it comes down, right? And again it starts, it comes down, but it's just like it's not progressing like a lot, right? It's just coming and going, that's all. But this the secondary like a progressive MS, it starts, right? After that it doesn't finish. Now the symptoms won't like finish at all, right? There'll be like there remain a lot of bit. Again, like next time it is start, and after that it's going to remain a little bit, and like this it's continuing, right? It's going. So what's happening now, like progressive like remitting? The symptoms start, it doesn't finish, right? It just like a decrease a little bit, and again when the person the symptoms like occur, it comes to complete the ones that like didn't finish before, to make it bigger. And again when like the symptoms come, right, and again it comes, it's going to be added like to the ones that didn't finish. So like this, every time the symptom will be like growing and developing. So this one is the flow type of MS. Clinical forms of MS. You have got like a typical, which are like a cerebrospinal. Also, you have got like a atypical, this one like spinal, cerebral, like a stem or optical, right? So you have got like a two type, typical and atypical one. So you have got like a different type of MS. Echo-disseminated like encephalomyelitis, Marburg like a disease, or optical like a mielis like a disease, or shoulders like a leukoencephalopathy. So this one like are the type of MS, right? So here, okay. Here there will be 3, alright, and here I'm going to put like a, here I'm going to put like a 4, alright, here I'm going to put 4, so hit this one, okay. So now, after we did all, after a patient comes to you and you check the patient and you see that the symptoms are giving you like the sign of MS, right? So before to be sure that like this one is MS, you need this one to perform like a diagnosis, right? So before to put the diagnosis, you need like to investigate the patient. The first investigation is MRI. So we are going to talk about like a physical criteria, which like was given in 1988. So here for multiple sclerosis is characterized by at least 3 areas with increased signal intensity. 2 of them must be in periventricular like space and at least 1 supratentorial. So the size of the focus should not be more than 5 millimeters in diameter. What does it mean, guys? So this means that like when you take an MRI, you are checking, you have to have at least 3 areas with intensity signal. So 2 of them must be in periventricular like space and 1 supratentorial. And also like there'll be like a focus, the areas shouldn't be more than 5 millimeters. So when you get this one, when you see the MRI, it's why like always when a patient comes to you with problems and you ask the patient like to do like an MRI, so please get and check it, so to be sure that like you are not like this one missing those criteria, right? So the criteria, this one is one of the criteria. And also at the same time there's like a particular like criteria in also in 1988. So what does it mean? 3 must be at least there must be at least 4 focus of hyper intensity. So here like of course there is like a 3 focus, here like is 2 focus, here it's 4 focus, so it's almost the same. But here we are talking about not larger than 3 millimeters, okay? So almost like they have got like the same criteria, right? Almost they have got like the same criteria, right? There two must be like in periventricular, like this one is space. Here at least one in periventricular space. So it means that if you see like a focus, right, on periventricular like space, you need like to continue investigating. So let's check what we are talking about. Here, this one are focus. Here, those ones are focus. When you get MRI, you check this guy. This one, right? You are checking. Right? You are checking the focus, right? You check the focus. So here, you get like there are walls here, right? You have got here. Here, you get like the walls are different here. You get the hyper intensity, right? You have got them here. Like those ones, when you get an MRI like this, you need to think about MS, right? When you get like such MRI, you start thinking about MS, right? You can see the focus, right? Here, and also you see the focus are here. You can see the focus, right? Here, you can see the focus. So all this one is spinal cord, right? So all this one like are the focus, right? So let's get here. So but after 1988, we have got also like a criteria, like a new diagnostic, like a criteria. So please like remember it. What does it mean? The new criteria one is talking to us. What is it telling us? Look at here. You have got like the focus here, right? Here you have got the focus, and here also you have got the focus, right? So please, what the criteria one, we need at least it's McDonald's like a criteria. It's called like a McDonald's like a criteria, which is specified that the criteria for dissemination like in time record the presence of one of the following: detection, right? Detection of at least. So when you do like one time MRI, you need to repeat it again, right? Wait. When you did like an MRI one time, right, you need to repeat it again like after 3 months. And after 3 months, look at what's happening. Here you can see, and after 3 months, when you see, there'll be like an increasing of the focus. You can see the focus like it can be increased. So when you get like a 3 focus now, and after 3 months, you ask the patient again, perform the MRI. The patient will perform again another MRI, and you'll see that the focus here will be increased. Right? The focus will be increased. Yeah? There'll be increasing of focus. So this one, we are talking about like a dissemination in time. Right? Dissemination in time. And also when we are going to talk about space, dissemination in space, So we are going to see them like they'll be like a different in different this one stages, like a different area. So here like we are talking about space. So we have got like a diagnosis criteria in space and in time, right? So here you can see like a visualization of the irreversible damaged tissues. So black spots. So look at here, those black walls are the demyelinization like this one process here. This one, so the person like will have like a black walls in his brain, right? So look at the black here. So, but here the one which are like this one here, and you are going here like here too, they are the same. You can see here, you can see them. So all those ones like are black walls, right? So once I did like in this one with like this one T1 image, and the other one was performed in T2 like image. So please look at right. So black walls. So when you see in a patient like a such, like a picture, just to think that, just to diagnose that like those ones are like this one, the demyelinating like focus of MS. So straight, you put like this one, you put like the diagnosis, you put that yes, this one is MS, right? Excellent. You put like a yes, this patient has got MS. So, and look at one thing else. Multiple sclerosis is the only one disease that you can see that they are already like this one focus like they are already like this one damage on the brain before even like that the symptoms like it starts, right? Before even the symptoms start. So this one is the only one disease. So please remember it. Alright? So once you put yes, you have got like this one space criteria, you have got like a time criteria, you have got like a black walls criteria, right? You have got like a charcoal like this one triad, you have got like what else? Yes, you have got like a charcoal triad, and you have like all the symptoms. So it means that like now you can put like multiple sclerosis. And which flow, so you see like this one depending of the patient, this one like the symptoms now. Treatment. What do we do? Hormones, right? So treatment of exacerbations of MS. So pulse therapy with methylprednisolone, right? 500 to 1000 milligram per 500 to 1000 milligram and intravenous, right, during 3 days. Then every day we perform like 2 to 3 times. So the doses shouldn't like this one would be over 5 to 6,000. So please remember this one. You have got like a plasmapheresis. 5 operations are performed within 2 weeks with the removal like of like 1.5 volumes of plasma per procedure. So then weekly for 6 weeks, right? So plasmapheresis, it means that like every time you see like you connect the patient, right? There is like a devices through which one, right, the blood will be like going through, right? So this one is called like plasmapheresis. So the blood, all the blood in the woman being like will be passing like through the devices which is going like to this one to clear the blood, to disinfect the blood like from like this one inflammatory like process. Immunomodulator like a therapy. Here like you have got like a beta ferron which is coming like from this one from Germany. You have got like a Revif like from Switzerland. You have got like a Avonex like from USA, or also like you have got like Supercon which is coming from it. So all this immunomodulatory like therapy to like perform. So treatment of MS. So with those like this one immunomodulatory like therapy, how do you treat them? If you choose like a beta ferron, like you have like this one international united, like you have got like 8 million international like united, right? After a day, right? You have, if you choose like a rebate, it means like 12 millions international like united 3 times a week, right? Either Avonex, which is like 6 millions international united once a week, or Superzone, which like you need like to perform like every day 20 milligrams. Symptomatic treatment of MS, neurolexant. You have got like a sildenafil, baclofen, or either like you have got like a mitocam, metabolic therapy, coordination of movement disorders, adrenal blockers, antidepressants, glycine, right? All this one, neurogenic like a bladder, mandatory like a reach for urination, calcium antagonistic, right? So all this one like a symptomatic treatment. But the treatment, like the main treatment is here, alright? So, okay, guys, now, after talking about like the MS, have you got like any question? Have you got any questions? Have you got any questions? Still like when we'll be having classes, we are going still like we'll come back to MS again, like to break it down. So I guess you don't have any questions. So if you don't have, it means this today's lecture it's over. Thank you for being present, and see you next time for the next lecture, right? So okay, goodbye then. Goodbye, see you next time for the next lecture, right? Okay, goodbye.